Alberta is facing a COVID-19 pandemic crisis. The ICUs are full, and there's even some patients are being flown out to other provinces. And Northern Alberta, like Northern British Columbia and other northern parts of other provinces, is being particularly hard hit. I'm going to talk to Jo-Ann Cluney, who is a registered nurse and at the Fort McMurray Hospital and also president of the United Nurses of Alberta, Local 96. So welcome to the interview, Jo-Ann.
Thank you for having me.
Look, how bad is it in Northern Alberta?
It's bad. It's right now we're incredibly full. The hospital is full. Our ICU, we normally have 6 beds and a 7th that we call a crash bed for whoever, if anyone crashes in the hospital. Out of those 6 ICU beds, we have 4 that were dedicated to COVID patients. And then we've also, because surgeries have been canceled, we also have expanded another 4 beds into what we call PACU, which is our recovery room where you normally go after surgery. Out of those 6 beds, like I said, 4 were dedicated to COVID. So that gave us total 8 COVID beds with respirators, but frequently all 6 beds are filled with COVID. We take patients, they're transferred in from Bonneville, Grand Prairie, Cold Lake, anywhere that when someone needs a bed with a respirator, that's where we go. We have about 11 RTs on staff that help to look for those patients. And in addition to that, we have taken over 12 beds up on the surgery unit. And on my last shift, 10 were full. And those were for COVID patients that did not require respirators. So the 11 RTs are responsible for all those beds as well. There's the ones that need additional oxygen, blow-by, anything that's not a respirator. So we are incredibly full. The one shift I had worked, we were so happy we had 3 empty beds in ICU in the early afternoon, but we had accepted 3 more. And then that evening we had one of our own come in that we had to transfer out, to fly out through Rapid to another center. So we are very full. I know working in emergency, pretty well every shift, there are COVID patients coming in. Thankfully, a lot of them their majority are unvaccinated. And that's what we're finding. And we are admitting all the time, either up to the floor or into ICU, pretty well on every shift that I have worked.
Are you noticing that the vaccination, that the crisis plus maybe the vaccine, we'll call it a passport program, even though the government doesn't, people are beginning to understand that they need to be vaccinated and vaccination rates are going up, or is this still a persistent problem?
Generally, I'm finding more people are getting vaccinated, and I think at Fort McMurray, it's because the major employers, the oil sands sites, are requiring vaccination. I'm still hearing a lot that do come in when I do the triage. When you first come to emerge where I assess you, I ask about vaccination status. And I'm very happy to say that a lot are vaccinated, but the ones who are unvaccinated, I do ask them why. Why have you chosen not to have the vaccination? Not to belittle them or anything, but to understand why. And I ask them if there's barriers that we could help with. Is it because they've got false information? Is there fears they're having? And I advise them to talk to the health professionals, talk to the doctor to get a real grasp on what the vaccination is. And I find there's a lot of misinformation out there that the general public is getting, that they're believing with the vaccines. And I don't know, I'm finding, we're at about 60-70% of Fort McMurray, I believe, that are fully vaccinated, and first-time vax, I think we're almost up to 80 from what I heard last. But all of the ones, we separate our triage area to two areas in the waiting room. One where you have no COVID symptoms or ILI symptoms, we call any viral symptoms, and the other wait room we put you in is to try to isolate. And all the ones that are in the isolation area, most of them do not have their vaccinations.
How serious is this? I mean, it sounds like you're busy, but is this a crisis? I mean, are surgeries being canceled? Are people not getting treatment for things like cancer or, organ transplants or whatever other kinds of treatment they require that are serious? Give us a sense of how how, I don't know, intense the crisis is in your hospital.
It is intense because I speak to a lot of patients, and a lot of them are telling me like they need procedures done that have been canceled. Because they're canceled, they're in health crises, so that's why they come to emerge. And that's why we try to, alleviate a lot of their symptoms. They're in pain, a lot with renal colic. They can't get into Edmonton, a lot that need colonoscopies, a lot, others that are looking for different procedures to be done, and they are canceled, hip replacements. And they're coming in with excruciating pain, but they cannot get in to have those surgeries done. I know many people who are waiting for ACLS repair on their shoulders and that, so they could get back to work, but those are being delayed. And so we do see a lot of them in emerge, and our emerge is full with a lot of people coming because they have no choice. They need help, but a lot of the procedures that would help them to alleviate their symptoms is not available right now. But I guess over and above that, what I really want to talk about is exhaustion of our nurses. We have been a nursing shortage for years here in Alberta before the pandemic. We were always short. And it's just gotten worse. A lot of our nurses are at the point of burnout. At the first wave, none of us knew what was going on. We were afraid for ourselves, afraid for our family. Vaccines weren't available, but we still came to work. That took a personal toll on us. Many of us isolate ourselves from our families for the 4 days that we're, our shifts are 4 and 4. 4 days we'd isolate ourselves from our family. We'd go sleep in the basement downstairs away from our family, shower or change in our garage before coming in, just trying to protect ourselves and our families. And then the vaccine came out. We were oh so happy. We all, we were the first in line to get our vaccines, to help protect ourselves and protect our patients. And we worked through all that. And that did take a mental toll. Like that was starting with a lot of people being scared to come to work, afraid for themselves, afraid passing. The worst thing is we want to pass on something to our patients. Our patients coming here for help, we don't want to get them sick. So we wanted to get our vaccines and do the best we can. And then then the second wave came and more vaccines were available. Third wave came, more vaccines were available. At first, we're seeing all the elderly coming in. And now with this fourth wave, going into the fourth wave, well, with all the cuts that were proposed by the government in the summer, all the rollbacks, we were feeling it was insulting, and we're feeling that we had low morale. We felt we were unappreciated. Then this fourth wave hit, and vaccines are widely available to everybody 14 and over. And what we're finding is all of this could have been prevented. Like a lot of that we're seeing them in their 40s, as young as 30s coming in, having to go on ventilators, and it was preventable. And with them taking up most of all of our beds and having surgeries and that canceled, it's just demoralizing. It's like, we're trying, our government needs to do something. I don't know what it is. I think maybe more education on the vaccines so people understand and not just listen to what's being put out on social media. I know I kind of laid back on Facebook myself because it's very demoralizing seeing all what was on there.
What have you had nurses and other medical healthcare professionals quit as a result of the burnout, and that we're seeing that in southern Alberta, and I'm wondering if you're seeing it in the north as well?
Yes, I have many nurses who have left the front lines, who have gone, either have taken other positions out at site or into public care or into other areas where they're not working frontline. Critical care nurses are leaving because they are burnt out. Some have said, we're close enough to retirement, we'll just retire. So we are seeing that a lot. And there's quite a few that are on stress leave because it's just too much to cope with. Like we're exhausted. Our part-timers and our casuals are working full-time hours. As a full-time person, I know on my 4 days off, I frequently pick up 1 to 2 shifts because our phones are blasting with all the overtime. And when I see the second, third notice coming out that my unit is short, then I'll pick up. And even then we're still short. So it's like you need your rest, but you also feel the responsibility to go in and help. So we go in.
Well, Jo-Ann, all the best to you and the folks that you work with. We hope that the vaccination rates pick up. Something happens to lessen the pandemic and the burden that you're feeling in the hospital. Thank you very much for this. Really appreciate your insights.
Thank you for having me.